Hi everyone. First of all, we would like to thank you for visiting us these conferences. Pakistan is our real brother country as from the histories and until now. And I will inform you regarding myself and my companies firstly. My name is Turan İlker Akpinar. We are the manufacturer of all kind of the hospital furnitures, hospital designing and the installations. I mean, from the previous speakers, our position a little bit different for the future hospitals, because we are looking regarding our sector's part, how we can improve our products with technologies and the future hospital systems, of course. Is it? Not coming. Yeah. All right. From Turkey to Pakistan, we are doing, until this time, so many different kind of the hospitals in Pakistan. Some of them with the governance hospitals, some of them from the army hospitals, and some of them from the private hospitals, of course. As the previous speaker said, the segmentation and the limit of the hospitals is so different in the Pakistani market. Of course, it is looking to developing day by day. Because my last 2 visits in the Pakistan, we saw that the buildings, products, technologies, and everything start to using in the Pakistani market, and it is showing us the new developments, as the Nitrocare hospital, for example. We have 3 facilities in Turkey. The Nitrocare is our medical brand, Office Line is our non-medical brands, and the Office Line 3 our chairs and the sofa brands. What we are doing with these 3 brands, we are producing the hospital products. Hospital products mean for the medical and the non-medical hospital furnitures. We are established the 2 different companies. The Office Line starting is 1993 and the Nitrocare is starting is 2009. Of course, how the hospital will develop itself, we have to develop our companies and our products also. What we are doing, we are directly inner of all hospital things. We are starting with the design. We are continuing with the project management. We are doing production and the installation. Of course, with this system, we directly listening our customers and customer needs. Of course, the segmentation is different countries by countries, and we are following directly with our customer needs for it. On the design part, what we try to do, we try to do the simple using, easy accessing and easy using for nurses, doctors, and the patients. This is the important things when one patient comes to the inside of the hospitals. Because I want to give you one sampling regarding this. In Turkey, our governance hospital system is turning public-private partnership systems. And these are like a huge implants. For example, we did the biggest hospital in Europe, in our capital city, in Ankara, 3,800 hospital bed capacities. You can think that the area, it is more than 10 million meters square. For the smart systems, when a patient comes to the hospital, they can find where they go. They can find which doctor they will treatment in there, and how they examine. This is the system what we try to do inside of the hospitals. Of course, the different way of the design is possible. In our understanding for the hospital features is digital hospitals. Of course, this has happened with the technologies and the smart systems. We can separate these points with the hospital design and the planning, smart patient rooms, robotic things. This is machineries and the systems, of course, on the both times, digital command center, direction finding notifications, and treatment process, home to hospital, hospital to home. From this list, the 2 point is our main professionalities. One of them is the hospital design and the planning, and the other one is the smart patient rooms. In these centuries, in this new generation and the new technologies, a doctor do not need to go to hospital at midnight, for example. If they want to check their patient situation from one mobile application, they can connect to the hospital beds directly, and they can check their weights, their positions, what they are doing. This is for easy using for doctors and, of course, to the patients also. Of course, with the technologies, everything will be developing. With this system, it's needed, of course, education system and the CRM system in the hospitals. If the hospitals have the enough CRM and the enough software system inside, the doctors and everybody can control and report everything. With this following system, they can understand their patient situation. Of course, we try to apply, as I said at the beginning, to our product this smart systeming. In the new technology for the hospital beds, we have touch screening system, for example. With this touch screening system, the system can saving the all information regarding the patients, and doctors and the responsible nurses can control from their mobile applications also. These are all applicable on hospital bed, stretchers, and the rest of the products, of course. Especially until last 10 years and after the COVID, these kind of things getting so important because the many countries understand it. Their hospital system is not enough for control the all kind of the problems and all kind of the patient, of course. For example, in Italy, there is no full hospital system before the COVID, sorry. But now they start to opening the new hospital with the full smarting system because people start to understanding if there is the urgent situation like the COVID, people need to be treatment. And this way is the coming from the full hospitalization. I will turning to what we are doing mainly again. As I tell you, we are doing the designing the hospitals with smart system and the feature connection systems. All the new generations and the new styles, the hospitals coming like the 5-star hotels, as you know. Of course, include this one, the service have to be 5-star for the patient. This is again coming from to the technologies and the educated peoples, of course. For example, in one patient rooms, the nurses can see from the nurse's screen what the patient can do it. These are all implementary with the technology on the material of the hospitals. Design of the hospitals also the same developing. On the old time, the hospitals not same as the highest qualities and the highest system, but new generation hospitals, all of them like they are feeling the people like their homes. And this is so important for the patient feeling, of course. As you can see, different designs, different models, different ways. These are all connected directly, technologies to the hospital development, of course. All big producers regarding our sectors, the hospital furniture sectors, they are developing the technologies, and we continue to follow the technologies because we want to connection from the patient, nurses, and the doctors directly. Because in our century, you know, the most important things, the timelines, and how many minutes you get from the information, you can do your solution the best way. Thank you very much for your listening.